I think we're at a very interesting time right now in joint replacements. Clearly what we've seen is a tremendous amount of success in our patients. Hip and knee replacement is arguably one of the most successful operations in all of medicine, but clearly there are areas that we need improvement. And so what we're seeing at this meeting is a lot of discussion about some of the controversial issues. One of the biggest topics right now that we're dealing with is the issue of bearing surfaces in hip replacement, particularly looking at metal bearings. I think if we were giving this interview 5-7 years ago, you would have heard a completely different story than what you're hearing now. Metal hip replacement 5 to 7 years ago really peaked in this country, and there's a lot of excitement about this being the solution for bearing surface wear for young patients, for active patients. And I don't think in my short career I've ever seen anything take such a meteoric rise and such a dramatic fall in such a short period of time. In addition to that, you're also hearing issues that are now arising with surgical techniques, approaches for hip replacements, approaches for knee replacements, how we treat our patients post-operatively as far as physical therapy protocols and pain protocols. So there's a lot of interesting issues right now in joint replacement, a lot of which we don't have great answers for. No question, I think it's education. If we can get 300 people in a room, whether they're physicians, physical therapists, nurses, ancillary staff, and everybody get on the same page about some of the issues that we're all dealing with. Because I think it's pretty clear that joint replacement surgery is a team approach. It's not just about the physician, it's not just about the patient. It encompasses their whole, what we call episode of care, from the minute that patient decides that they want to have a joint replacement all the way to the end of their care. And so much of that, what we know and what we don't know, hinges on not only educating the patients, but educating the care providers as well. And you're right, I think we have some of the leading experts in the field talking about a lot of the controversial issues. And so much of the problem that we deal with today in joint replacement is the media and things that are hyped, both positively and negatively in the media, without a lot of substantial research behind it. We're in a very unique situation at OrthoCarolina, being essentially a private practice group, and yet we have one of the most robust and active research institutes in the country. We publish and produce as much research as the Mayo Clinic, as any major academic orthopedic institution in the country. We currently have over 28 FDA clinical trials going. We have over 80 clinical outcome studies. Our research group manages over 6,000 patients every year, and we publish over 30 articles in the peer-reviewed literature every year. So we talk about education, but if you take a step back, what's prior to education? It's what we learn doing research that then allows us to educate patients and people that attend these meetings. Yeah, I really think we're just at the tip of the iceberg with this technology. I think it's going to revolutionize how we practice medicine. It's going to revolutionize how we care for our patients. The fact that we'd be able to potentially communicate with patients from home, to be able to look at incisions over live pictures, over Skype, to be able to get a sense for how our patients are doing from remote locations, I think is going to be critical for us, particularly as we see a rising volume in the number of patients that need joint replacements as the baby boomers age. We're going to have to figure out a way how we can look at these patients without trying to cram everybody into our office. Not to mention just the efficiency of using electronic medical records, of us being able to walk around with tablets in the office, and how much more efficient our delivery of care is going to be for patients. So I think we're really just at the tip of the iceberg with that type of technology.